Here's some interesting new news for anybody on Medicare. Now, after reviewing the 2025 annual report of the Board of Trustees of the Federal Hospital Insurance and Federal Supplementary Medicare Insurance Trust Fund, what a name, there are conclusions buried in this report that most retirees will never hear about, but will absolutely feel. This is not speculation, this isn't politics, and this is not about Medicare collapsing. What the trustee reports quietly confirms is something far more unsettling. Medicare is financially stable, but the system is shifting more and more of the financial burden directly onto beneficiaries. Higher premiums, income-based surcharges, out-of-pocket expenditures. These changes don't arrive with warnings, they arrive with bills. If you're already on Medicare, this video matters, and if you'll soon be starting Medicare, this is information that will directly impact your retirement. Because what's happening isn't a future risk, it's already built into the system, and it's accelerating. Now, before we get started, I've included links below to the 2026 Medicare rates for Parts A and B, as well as the 2026 Medicare supplement benefits and the IRMAA table. So feel free to print those out and download them. They'll be in the links below as well as in the pinned first comment. You've probably heard this before. Medicare isn't going broke. And that phrase creates a dangerous sense of comfort because retirees hear the word stable and assume affordable. Those two things are not the same. Medicare Part B does not operate like a normal insurance program. It does not run out of money. Instead, it's automatically financed, and the trustees say this explicitly in this report. The trust fund, I'm going to quote, "The trust fund is expected to be adequately financed over the next 10 years and beyond because income from premiums and federal government contributions for Parts B and D reset each year to cover expected costs." That sentence matters more than most retirees realize because what it means is simple. When Medicare costs rise, your premiums are reset upward to match them. There's no debate, there's no warning period, there's no opt-out. Stability is preserved by charging beneficiaries more. That's not a theory, that is how the program is designed to function. So here's why so many retirees feel squeezed. Even in good years, Medicare costs rise faster than Social Security cost of living adjustments. Now, some people are partially protected by something called the Hold Harmless rule. And here's the short version. If you're already collecting Social Security and your Part B premiums increase would be larger than your Social Security cost of living increase, that increase may be limited so the amount of the check that you receive doesn't go down. Now that sounds reassuring, but here's the problem. Hold Harmless does not stop costs from rising. It delays and redistributes them. It does not apply if you're subject to the income-related monthly adjustments amount, or if you're not yet collecting your Social Security. And when cost of livings are small or zero, premium pressures build behind the scenes and show up later as even sharper increases. So Hold Harmless doesn't fix the problem, it hides it temporarily. This is not a bad year, this is not a one-time spike. Trustees are clear that spending pressure is structural. And I quote, "The trustees project that Medicare expenditures will increase at a faster pace in future years than the aggregate workers' earnings or the economy overall." Read that carefully. Medicare spending is projected to grow faster than the economy itself. And when costs grow faster than the economy, someone has to absorb the difference. Increasingly, that someone is retirees. Now, IRMAA, we've mentioned before, stands for the Income-Related Monthly Adjustment Amount. It's an additional surcharge added to your Medicare. You're added to your Medicare Part B premium and your Medicare Part D premium. And it's based on your income from 2 years ago, increasing your Medicare premium no matter what you do today. That delay is critical because by the time IRMAA shows up, The decision that triggered it has already been made and it's already behind you. So IRMAA brackets are adjusted for inflation using the CPI-U, the Consumer Price Index for urban consumers. And let's be honest, we all know the CPI-U understates real inflation, especially for retirees. Healthcare, insurance services, housing, food, these costs consistently rise faster than the CPI-U reflects. So while IRMAA thresholds technically increase, they fail to keep pace with the real inflation that we feel today. And that's why more retirees cross the IRMAA threshold without changing their lifestyle at all. And once you cross them, your Medicare premiums jump, often dramatically, for the entire year. So let's connect the dots. Medicare Part B premiums rise automatically, IRMAA surcharges expand quietly, Social Security COLAs lag behind healthcare inflation, and the CPI-U understates real cost increases. All of this happens in the backgrounds. No alerts, no warning, no planning window. You don't experience a crisis, you experience erosion. Medicare is not about to disappear. That's not the risk. The real risk is assuming that system stability means personal financial safety. It doesn't. The system protects itself by adjusting your costs gradually, legally, relentlessly. And the longer you're on Medicare, the more exposed you become. This video is urgent for a reason, because Medicare does not send warnings. It sends premium notices. You cannot control healthcare inflation, Medicare funding formulas, or federal budget politics, but you can control how income shows up on your tax return, whether IRMAA catches you by surprise, and how Medicare fits into your retirement strategy. Awareness is no longer optional. If you're already on Medicare or approaching a phase of retirement where income decisions matter more, ignoring this puts your retirement budget at risk. So subscribe if you want to understand these changes before they show up in your premiums, not after. In the next video, I'll explain why Medicare costs rise faster than almost everything else in retirement, and why that trend is not reversing. I'm Matthew Clausen with MedigapSeminars.org. I'll see you in the next video.